kind of waiting for everybody to get here. My name is Susan Southwick. George DeGante and I were the ones that organized this and put it together. George, do you want to stand up and wave? I'd like to thank you all for coming tonight. It's really nice. Healthcare is important, and I think we all need to gather as much information as we can so that we can make informed decisions about where we all think it should go. Real quick, we have got the guardian angels here, and I want to invite their president to just stand up for a moment. Freddie, and come on up here, and would you like to just say a few words about your organization and what they do?
We appreciate.
But not on.
Testing, yeah. Okay. We appreciate you guys inviting us over. As you know, the Guardian Angels, anyone that does know about us, we exercise our rights as well as citizens. We go out and we patrol areas. We focus on trying to keep neighborhoods safe. If there's any drug activity gangs, we're right there in the middle to pretty much either push the people away, reprimand them, wait for the police officers to come. So if there's any questions as far as anyone interested in the Guardian Angels, I'd be more than happy to talk with you after. But we're here right now in support of you guys too, as far as the Tea Party. So, we appreciate, once again, we thank you for having us over. And feel free to come and talk to me after.
Thank you.
Thank you, everybody.
Okay, we're going to get started here. Tonight we're going to hear from Representative Chris Herod and Dr. Trent Jones. Again, after they speak, they'll be available for your questions. I also have a statement I'm going to read from Cherlyn Eager. She had another commitment tonight, but she wanted to have me read something for her. I was just going to take a few minutes and talk to you about my experience. Well, first I want to tell you we did invite our Washington representatives and senators. Representative Matheson declined pretty much immediately, about 20 minutes after the email went out. Representative Chaffetz, I talked to his scheduler, she checked, he did have another speaking engagement tonight. Senator Bennett was going to be down in the Delta area. Representative Bishop's office said they would be letting me know, as did Hatch's office, and I'm still waiting to hear, so I'm going to guess that they're not showing up. But, there's surprises happen. So, we all know that health care is an important decision, and I feel really strongly about it. I want to just take a few minutes and tell you about my experience I had with my insurance company. They say about 70-some% of people in this country are very happy with the health care that they have and with their insurance. And I would number myself as one of those 70%. Along with the bad experiences we all hear about, I think you need to hear about the good ones as well. Back in March of 2008, I was diagnosed with breast cancer. My sister had just been diagnosed, and she called me and urged me very strongly to go get a mammogram because, we all put it off because it's not real fun. I called, I made an appointment. They were able to see me the following week, didn't have to wait very long. A few days later, I got a call and they said, come back, we want to take another look. And on that same day, they were able to tell me, yes, you do have cancer, we're going to do a biopsy. It's not very advanced. Do a lumpectomy, you're going to be fine. They scheduled the biopsy for a couple of weeks later. And it was I'll be honest, it was nerve-wracking just waiting a couple of weeks for the next step and to find out what was going to happen. And when they did the biopsy, they then informed me that it was more widespread than they thought and it would require a mastectomy. That was kind of unnerving too. I like my body parts and I don't want to lose any of them. And although I knew they do great things with breast reconstructions, it was still not a fun prospect to think about. And the thought of an implant, I've never thought that sounded fun. I just didn't like the whole idea. Well, I started doing my research and found out that there was a procedure available where they could actually reconstruct the breast using the patient's own tissue, which I thought, now that sounds good. I like that idea. The downside to that for me was there were only a couple of surgeons in the Salt Lake area that would do that surgery, and neither one of them were on my insurance. That was disappointing. The one doctor did tell me, however, I could go ahead and have her perform the surgery, and it would probably cost me about $32,000 out of pocket for just the reconstruction. That wasn't an option for me. I didn't happen to have $32,000 laying around in my bank account. I did talk to a surgeon who was out of South Carolina, and she told me she would be happy to work with my insurance and see if she could convince them to cover her. She did that for me. They agreed to cover my doctors, surgeries, and everything in South Carolina. And I was able to travel there at my own expense, but that was still cheaper than $32,000. I don't travel first class. And they took good care of me, and it was a positive experiment. Now, you know, President Obama made a statement, something to the effect of, if you have a red pill and a blue pill, and they both accomplish the same thing, but the blue pill is cheaper, why would everybody not want to take the blue pill? Why would you ever take the red pill when it's the same as the blue one and it costs less? Well, I'm not sure that's a choice I want the government to make. I mean, arguably, you could look at me and say, well, she can have an implant or this breast reconstruction with the tissue. It's both the same thing. Why wouldn't you take the cheaper option? You know, well, you dig a little deeper and you find out there's problems with implants. A lot of them have to be replaced. Once you get the other one done, you're done for life. And for me, the red pill I thought would work better than the blue pill. And I really didn't want a government bureaucrat making that kind of decision for me. That's how I feel about it. It's kind of interesting. Breast cancer, the death rates in the US are about 18.7%. In Canada, it's around 22%, and in the UK, it's 32%. With prostate cancer, the death rate in American patients is about 19%. And the National Center for Policy Analysis reports that it kills 50% of the Britons who are diagnosed. That's kind of amazing to me that there's such a wide gulf there. The Organization for Economic Cooperation and Development data show that the UK's 2005 heart attack fatality rate was 19.5% higher than here in America. And this may correspond to angioplasties, which were only 21.3% as common there as they are here. Now, Canada also has 1/3 fewer doctors per capita than the OECD average. The Dr. David Gratzer, who is a Canadian physician and Manhattan Institute scholar, told the U.S. House and Ways Committee on June 24th that the doctor shortage is a direct result of government rationing, since the provinces intervened to restrict class sizes in major Canadian medical schools in the 1990s. Some towns there address the dearth of doctors with kind of a lottery in which citizens compete for rare medical appointments. In 2008, the average Canadian waited 17.3 weeks from the time his general practitioner referred him to a specialist until he actually received treatment. The Pacific Research Institute president, Sally Pipes, a Canadian native, wrote in July 2nd's Investment Business Daily, that's 86% longer than the wait in 1993 when the Fraser Institute started quantifying the problem. That includes such things as a median 9.7-week wait for an MRI exam, 31.7 weeks to see a neurosurgeon, and 36.7, which is nearly 9 months, to visit an orthopedic surgeon. To quote Amy Ridenour, who's the president of the National Center for Public Policy Research, she says, to meet budget targets, governments reduce payments to providers and to buy equipment. This reduces the supply of people willing to provide healthcare services, such as doctors, nurses, medical staff, and support, and the supply of equipment, such as hospital beds, diagnostic tools, etc. Shortages develop, and those who are sick and injured suffer. They find themselves with health coverage, but without health care. Now, I'm grateful that I didn't have to wait months for my initial mammogram, and then wait weeks or months for the biopsy, and then longer to have my surgeries. I feel like I'm really blessed that I live here in the U.S., where health care is world-renowned, and it's available to your average citizen. I thank you for your time. I'm now going to read a statement by Cherlyn Eager regarding health care, and then I'll turn the time over to Representative Chris Herod, and then Dr. Trent Jones will speak. Yes? My husband has a question or a statement, I guess.
Well, not a question. I can't tell you. Everything for private insurance. She's a liar. You know, I'm not sure she would have done it with the national health care. So, and she's got two bedrooms, so I was there.
Thank you, Lexi. Am I read yet? Wow, I wasn't expecting that. I'm sorry. Okay, I've been asked to represent Cherlyn Eager. I had invited her to speak, and she did have a previous engagement this evening. She's speaking down in Provo, and she couldn't be here. But I'm going to read this statement for her, and then, again, I'll be followed by Chris. Okay, there are many proposals for health care reform. Cherlyn asked that I read these comments about one proposed solution, which is the Wyden-Bennett Socialized Health Care Bill. I want to explain this bill in terms of principles, the principles of the free market. Senator Bennett sponsored this bill, yet upon a closer look, this bill is really a socialist-like proposal. It gets some of the right premises correct, but its implementation violates free market principles by keeping the federal government in the driver's seat through a series of federal mandates. Understand this principle. A federal mandate is a violation of free market principles unless it covers one of four areas that the founders espoused: illegal force of purchase, fraudulent practices, monopoly, and debauchery. This bill includes several federal mandates over the private sector managing how it does its business as follows. Number one, it unconstitutionally identifies health care as a universal right. The federal government has no power enumerated to it to manage health care in any form or degree. Number two, it mandates that insurance companies cover abortions. Religious insurance companies such as the LDS-owned DMBA would be excluded. All other insurance companies would be forced to cover abortions. It mandates portability and prohibits employers from covering their employees. Employers would have to participate in the government health care system. It puts the federal government in a cherry-picking position, telling taxpayers which insurance policies they will be allowed to select. This will put smaller consumer-based insurance companies out of business. Number five, it mandates universal coverage under the guise of offering private choices. Insurance is about underwriting risks. These mandates drive the cost up for everyone because insurance companies cannot deny coverage to anyone. This is unrealistic and unsound fiscal policy. Instead, we should be looking for consumer-based or consumer-directed solutions. The solution is to get the federal government out of the healthcare system. The federal government caused the problem in the first place. If high-deductible, catastrophic consumer-based plans are structured properly, the statistics show they offer better benefits at a lower out-of-pocket risk. Isn't that what we all want? More doctors are beginning to stop taking on the Medicare patients. Why? Is it because they're cold-hearted? No, it's because they can't afford it. Any doctor will find that they can afford it less and less with a single-payer plan and other counterfeits to the free market system, such as this bill. My father was a doctor and a good one. He was chief of staff at Hollywood Presbyterian Hospital and an adjunct professor of surgery at USC. In the early 60s, he and my mom asked Ronald Reagan to speak at a California Medical Association convention. Reagan's topic was on Medicare and the dangers of socialized medicine. On July 30th of 1965, Congress passed the first Medicare bill. This is how my dad's office used to be run. I know because I worked for him. On the day of the appointment, a patient could be squeezed in if it were an emergency instead of being referred to the emergency room for an enormously expensive visit. Once there, the patient had my father's full attention. Some stayed as long as 3 hours. It was a personal relationship between the doctor and the patient. Today's doctors must see up to 60 patients a day to stay ahead of their 70% overhead. The lab work was done in the office: x-rays, blood work, urinalysis. I did the lab work myself. Before the patient left the office, the results were in, unless an extended culture were required. Upon checkout, the patient wrote a check and we gave them a receipt. If they couldn't pay, my dad would take in-kind payment, or if that wasn't possible, he could write it off. Doctors got brownie points and gold stars from the Medical Association for the charitable work that they did. My dad would make an occasional after-hours house call if necessary, and especially if a patient couldn't afford the hospital emergency room. When Medicare passed, the office had to start changing more to cover the expense of the paperwork. It was enormous and complex. Ambulance chasers got into the middle, malpractice insurance became imperative, and the cost of doing business skyrocketed. Government should not be involved with health care. The free market should be allowed to do what it does best, respond to the needs of the consumer. Here are some options aside what I identified above. The federal government is already managing 2/3 of our health care system through Medicare and Medicaid. Republicans and Democrats have failed to restore the free market system and to varying degrees are both proposing socialist reforms. The president's plan carries an estimated $1.5 trillion price tag. It is precisely federal intervention into the private market that has caused the massive increases in health care costs in the first place. Adding to the soaring costs are the trial lawyers who chased after doctors without any tort caps. We need to implement a new system of the loser pays, along with limitations on litigation claims and rewards. On the Senate side, tort reform is protected because over 60% of the Senate are attorneys. The solution to this healthcare crisis is to implement free market solutions, including healthcare savings accounts, tax credits to cover the cost of rising insurance premiums, cash-only doctors, which you will usually get a 60% less cost, and limiting medical malpractice awards to decrease healthcare costs. Then we can repeal the Medicare Part D prescription drug benefit, which represents a gigantic $16 trillion in unfunded liability. At the end of the day, we must behave as citizens of a free republic and take personal responsibility. We must stop expecting government to be the giver of all benefits. We must look in the mirror and remind ourselves of this adage from Pogo. We've met the enemy and it is us. Now, as Dr. Laura would say, go do the right thing. Let us take an inventory of how we may be contributing to the problem and then be the first to take personal responsibility for our own lives. So thank you for your time, and I will now turn it over to Chris.